Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne and scars and pigmentation. I do a lot with collagen stimulation as well. I'm going to walk you through this patient. This is after a single combination session for this patient. It's a year later, 11 months later for this patient. You can see this amazing improvement. Sometimes he comes on live. Actually, he's all the way on the East Coast. He came all the way over there to visit us last year, and then he came again, and he said his skin's even better now. So it's going to be even a better result. When I show him next time, he comes from really far away. But you could see just significant improvement after a single session here. And this is one of those things that I love to do, and really for patients that come in from all over the country and the world. I just talked to a patient earlier today from Germany. It's like I take this responsibility extremely seriously. I just want to solve this problem at a very, very high level. So it's really cool to be able to see this, actually, really cool. And by the way, thanks so much for coming on. Hi, Sailor Moon, good seeing you on. I know that I wasn't on yesterday, but I appreciate everybody just being patient and messaging me. And a lot of people actually also submitted some photos on my page for me to review for this live. And I'll try to do it actually during this week too. I'll try to review the photo and just to kind of give you an idea of what I would do for your scars as well. Hi, Resin. How's it going? Good seeing you on. Hopefully you're healing well right now. For those other people that I see that are actually, I see a lot of people actually who are my patients on, hopefully you're all doing very, very well. Appreciate you. Some of you don't even have scars and you're on right now, which is really, really, really nice. So thank you so, so much. So I will go through this case and just kind of talk a little bit about some other things I did today. I had a really cool case actually I had a few cases that were really cool. One of them was with a patient I did a phenol peel on yesterday. She came all the way from New Mexico. Really sweet lady, sweet woman, comes on the live also sometimes. And I don't know if she'll be on tonight because we just did dermabrasion today. So those who don't know, dermabrasion is basically where we sand down some of the scar tissue. We sand it down basically physically. And I did that in this case after I did the phenol peel. Essentially, I did a phenol peel, which is the deepest, strongest chemical peel for scars that we could possibly do. It goes down even to closer to what's called the reticular dermis, so the very deepest layer of the skin that we could safely go. And we could remodel the skin very, very well. We could stimulate more collagen production that way. Really, really amazing for patients who have thicker scars, patients who really just want a more polished look and just they're okay with the downtime. So, we could get there. We could get there with something like a phenol peel if the patient's the right skin type. This particular patient, really interesting story actually. Really sad for her, really in many ways, was that she has a thriving veterinary practice. She works with her husband with that, and it's an amazing practice and does very, very well. But she felt that like just her scars were were holding her back a bit in life, and she had it when she was a teenager. And then she said that she also suffered a lot with, unfortunately, with many miscarriages. Had some acne during that period of time too. And ultimately then, while she had several miscarriages, she ended up having twins then actually without IVF, which was really amazing actually for her. And then she was left with some of these scars and just wanted to improve it and wanted to work on getting that better, and tried a whole long journey out of state to get that done, and just wasn't really getting enough improvement with it. Tried a lot of things, fat transfer, CO2 lasers, a lot of things, and did Subcision before. But it wasn't until I did Subcision last month, and now we're doing the phenol peel, that she's going to get, now she feels like she's already seeing enough improvement just from the Subcision, and we'll continue to get better and better results now, of course, with the phenol. So really amazing story. It's actually, then I had another patient today who was talking about how she's been struggling and going through potentially with the IVF process as well, and had miscarriages as well. And it's kind of, there's like a community that we have within the scar world that people really do recognize a lot of times the suffering that other people have, and it's like it's interesting. It's an interesting process. And that patient that I talked about earlier, she was just like, open to sharing her story with other people and telling people that like, there's hope at the end of the tunnel and light at the end of the tunnel. So to those just joining us, this is after a single session over here for this patient. And, of course the scar is still visible because it's a single session, and these are realistic results for these kind of scars. So this is still going to improve, and we just got really some more improvement after this session in January. I'll see him again at some point, but he's all the way out of state, and he's comes on here. He said he's very, very happy in life, and I'm not sure when I'll see him again, but hopefully at some point, and we'll polish it off even more. I'm going to put down here for everybody to see that this is a single session result over here, so people could see on here. Hi everybody, good seeing you on too, by the way. Thank you so much for coming on. Lisa's on here too. Linda is on here. And let's see here. Where was I at here? I missed my spots here. Bella Baller's asking how I am. I'm doing very, very well. Thank you. Do I work with estheticians? Not so much, to be honest with you. I mean, I have a lot of really amazing estheticians in my area who do refer patients. Some of my patients are estheticians. It's actually interesting. Actually, I had a patient the other day who told us her story, and we put it on our page as well. She's an esthetician, came from out of state, said that she suffered a lot from acne, and really wanted to get the best possible results, best possible treatment for her scars, because it was really problematic. The way she was explaining is that just as an esthetician, she found that it was really tough to have scars. People just tend to look at the scars, and she wanted just as smooth as possible. And it was amazing. Really, I did a session with her, a single session for her. Amazing improvement actually for her as well. So estheticians, I have a lot of estheticians in the area, a lot of estheticians who refer to me, and they're really nice because they recognize the fact that they potentially, have someone in front of them, I should say, who has severe acne or who has scars, and they want to actually get a proper solution. The estheticians have a really, really good role, which of course I actually use estheticians myself. Actually, one of my estheticians that I used to use back in the day, 15 years ago or so, back in Chicago, she came on one time. So I have a high regard for certain things what they do, like in terms of just like a mild like exfoliating. I think that's pretty good for it. But sometimes with the extractions that could cause scars, and then I don't particularly, I do find problems when they try to treat scars, especially with things like microneedling or like sometimes just say microchanneling, things like that. This really does need a lot more than that. And so I do appreciate the role, especially for like some mild acne or so. I think that really helps out for people's confidence. But maybe, if you're out of the area, out of state, and you're an esthetician, consider finding someone that can do scars and see if there's some work with them. Let's see here. Lucky Singh is saying, hi, Dr. Qazi. I saw that you had a patient from Canada. Could you please share what they had done, how many times they will need to come, and any challenges they face coming to America? Thank you so much. Actually, yeah, today I did have a patient all the way from Alberta, Canada. He flew 6 hours today. I was talking to him about Banff because I really want to go up to Banff. But yes, I will say that his scarring was very, very deep, thick scars, deep ice pick scars. It's going to take several sessions, which he's aware of, probably about 6 sessions worth of TCA Cross if he just has a normal collagen response. But if it's a more robust collagen response, maybe 3 to 4 TCA Crosses, probably about 2 to 3 laser sessions for him as well. So, it all just varies on what type of scars they have and how deep they are, what type of skin type you have, how much oil production there is. His were very, very deep, thick ice pick scars, and it's going to take work. But he tried things over in Alberta. He knew that there really wasn't going to be much improvement with the treatments that he was offered, and so he came over to me just to get the best possible result. And I told the patient I was talking to today from Germany that I obviously, even if you're nearby, like next door, I'm still going to make sure that this is done extremely, extremely well for you. But especially paying attention, like our whole team pays attention when you're out of state, out of the country, we're going to really make sure that things are done like so you could just get a very, very smooth process. From start to finish, you come in, everything's taken care of for you. So there's even some programs like the patient that I was talking about earlier who came from New Mexico. She is with a place that actually has a nurse that's constantly with her and managing her for a couple of days after a Phenol Peel. And that's awesome, so she's going to be able to just relax and recover then properly there. Lucky Singh is saying, I wish I was there, and the doctors here really are behind in acne treatments. I've been involved with the acne organizations here, and there is so much left to do. You give hope. Just difficult to see you. Thank you. I appreciate you. The person that came in today from Alberta, he said there was no problems whatsoever with flying in, by the way. No problems whatsoever. So hopefully that should hopefully ease your mind there. Skin Lover is saying, how do you feel about Juvelook Volume? In Korea, we use this for acne scars. Not sure whether it will work. It's not going to help enough, really. These are temporary solutions. This really requires a more in-depth approach. You have to really look at the skin three-dimensionally, see how the scars wrapping around the skin, really see how basically your skin sometimes needs to get, or I should say the scar tissue needs to be broken up with subcision before we do something like filler, like Juvelook. So there's a lot more involved. And then of course there's texture issues that need to be solved with laser. Juvelook is something that some of my patients have done before over in Korea, and they haven't said that there's been much improvement though. So I should say people that came to me after they did Juvelook, and then they come to me and they say, they weren't too happy with it, weren't pleased with the results, found that it was not particularly helpful. And then same thing with Rejuran. I heard a lot of people saying Rejuran was very painful for them for scars, and it didn't really help much for the scars. So, I think there's better options out there. And unfortunately, I know that it seems like it's a great option just to be able to go to somewhere like Korea, for example, which I think they do a great job at some of their lasers. They really did push things for darker skin types, for Asian skin types, really pushed it so that you could do certain lasers on their skin type safely. But the actual truth is, though, that a lot of what they're doing is just more for like fast turnaround. A lot of these clinics, a lot of these practices are more for like tourism, and they're okay with the fact that just, it's just gonna be a light treatment, just something just to kind of like a quick pick me up. You'll hear a lot of patients say it looked great for a week, it looked great for 2 weeks. And since it's relatively cheap, it's much cheaper, of course, than in the United States, people don't feel too upset about the fact that it's only lasting for a little bit of time. But I mean, personally, something that you're still spending hundreds of dollars and it's like only lasting a couple of weeks, I wouldn't do that. That's my own thing. But everybody, I won't say how to spend your own money, but that's like, I personally wouldn't do it. And they don't really do this kind of treatment. They don't do things like in this kind of skin type with Subcision and with TCA Cross, with laser like this that we had to do to be able to achieve this. And you'll never see them do that way. Like in terms of like these practices that people are going to as tourists, nobody's really showcasing it that way. So I think just pay attention to that. It's not like I'm against it. Actually, one of my sisters is just literally just went over there, and she's gonna go take a look and see the spas and things like that, and enjoy it and all that kind of stuff. And that's great, but like it's more just like it's like a fun type of thing. Certainly not for like an actual skin condition like scars. Salma is asking, hi, can hypopigmented scars on the hands be treated, and how? That's a good question. It may not necessarily be treated properly, it may not, or fully, I should say. Sometimes what we may end up doing is actually we could do something where we use a laser, and what we do through the laser channel holes is we put something like lattice through the laser channel holes, and that could hopefully trigger a bit of the melanocytes. But you still may not see that you get a full correction, really. You may not actually come out enough. And so just pay attention to that. It's possible that it's a more permanent concern, more permanent problem. Yeah, I don't know if you tried UV lamp therapy. That's something that actually does help a bit there too, especially initially with scars. But it's possible that because the scar is so deep that it destroyed the melanocytes and you don't necessarily have a full correction of return in pigmentation. So do you do full body laser for hyperpigmentation? Yes, we could do that as well. We could do it for any area really if you need to. We could absolutely do that. So if you need to, we could absolutely do that. Is 32 too young for a Phenol Peel? No, it's not. I mean, it just depends on what kind of scars you have. If you have thicker, deeper scars, that's totally fine. If it's like really the walls around the scar tissue is thick, if you're somebody who's the right skin type, then that's absolutely something we could consider. But it's not about necessarily your age. It's just about the kind of scars, your skin type, and what you're trying to achieve. If you have enough downtime for that, those are things that we're going to take a look at. Let's see here. What percentage of TCA do I generally use? I use anywhere from 35 to almost to 90%. So it just depends on what's happening with our, really with our scars, and essentially, really the depth of them, the size of, like the width of them, the skin type. All those are all factors really. Audrey Pax saying, could it make sense to say that 5 rounds of skin pen microneedling treatments made my acne scars worse in the long run? Unfortunately, Aubrey, it's possible, actually. It is possible. The reason why is because sometimes in boxcar scars, they actually could make them wider. Sometimes actually in ice pick scars, they can. This patient actually did 10 microneedling sessions before he came to me. 10 microneedling sessions before me. I forgot about that, actually. He came on here last time and he clarified that for me. I said it was like 8 or something like that. He's like, no, it was 10. 10 microneedling sessions, actually. So imagine that. So unfortunately, it didn't help for his scars. He's really found it was a pretty frustrating experience for him, and also the radio frequency microneedling, which didn't help for him. Fortunately, he didn't find that it made it worse, but it didn't help at all. Luna saying Fitzpatrick 4 and 5 can't do phenol. Is that correct? You can do it for Fitzpatrick 4. Fitzpatrick 5, really difficult to really justify. It has to be very, very thick scars. Be okay with the downtime. Be okay with the loss of pigmentation that could potentially happen there. We really will have a real robust conversation about that, because it's possible that we don't have to do that. We just do other treatments there. Hi, Mrs. Jones. Good seeing you on. Thank you so much for saying that these are great results, by the way. Appreciate you, as always. Thoughts on NeoGen plasma? I am always open to things. I just never really see much from that blows me away. But I'm open to it. Maybe at some point I'll try it out myself and see if there's a different way of doing it that maybe that we haven't explored. Mel is asking, are there lasers that are good for decreasing oil production? If so, what is best? Yeah, I have both of them, actually. I have the Cure laser and AV Clear. And between those, I definitely prefer a Cure, because you can get real-time feedback. Every single time you fire the device, you know exactly the temperature that needs to be done in the patient's skin to normalize their oil gland. So these are 1726 nanometer wavelength lasers that just all they do is target the oil gland. And what's nice is that your regular skin doesn't get affected. So you actually just have no downtime. You just go bounce back and you're totally fine. Just go about your day. But it's just shrinking your oil gland. And that's what really this whole problem here was, because the oil production. The excess sebaceous gland causes the acne. And then that acne, some people have a really hyperactive immune response, which causes your body to destroy that bacteria, and then also your skin, and also sometimes your fat. And that's what we were looking at actually with a lot of these scars. And it's really problematic. Aubrey's saying, my mom says my skin looks worse after microneedling. I went in thinking I needed to go to CO2 laser route and was talked into skin pen. I'm sorry that happened to you, Audrey. I'm not sure, why they considered a microneedling device instead of CO2 laser. It's probable that they weren't comfortable doing the CO2 laser in your skin type, or for scars. So feel free to talk to us, and go through my page, drqazi.com. We could see what exactly needs to be done. Maybe it wasn't even laser. Maybe you thought that you needed a laser, but it needed other things. Let's see here. Brendy is saying there's people on TikTok showing others how to do TCA Cross at home. What are your thoughts on that? So the thing is that there's a lot of patients that I deal with that have done these at-home treatments, and they've caused severe widening of their scars. It was a small scar, it got wider, and it's a lot more complex to fix that scar now. It's very, very difficult to fix scars that are wide and deep, and that's what improper TCA Cross could do. I myself, I do probably the most TCA in the world, really. I mean, it's most likely. And I would never touch my own face with TCA. So I would never go and use a paintbrush or use a stick or use a needle and put TCA on my own face. I think that you should really understand that, like what that means. I have an extraordinary amount of focus as I'm doing TCA. My hand is completely still, and I still would never do it on my own face. It's just not something that your brain just has a very difficult time processing when you're trying to put something, just inject or anything else on your own face. It's very, very difficult to do it exactly perfect. Very, very difficult. And I'm not saying it's not completely impossible, but the chance of a layperson being capable of doing that is so slim that it's so reckless to do that. Like I would say that it's just it's not, I mean, it's so unfortunate that someone's just even just pushing that. and they're doing things that could potentially cause a catastrophic reaction in their audience. They're doing it for reviews. They're doing it just so that they think that this is something that is going to get back at the people that charge for TCA Cross or so. But the truth is that this TCA is very reasonably priced for something that gives you a really excellent improvement over time. I do it with a combination on purpose because I want to make sure that we're hitting every layer, especially initially. But over time, we just keep on doing some TCA, and you'll see the scar rise and rise and rise and shrink, the diameter of it shrink over time, and it works incredibly well for that. But it's got to be done properly. It's got to be done very, very well. So I'm confused by a lot of times when people are showcasing to others about like TCA, and they say what percentage that they're using and things like that. It's so unfortunate because it's like, for example, in this particular patient, I'm looking at this right over here, and I'll tell you that like not exactly every single one, but like each layer of these scars is a different concentration. So let's say there's like a deeper scar over there, I will use a higher concentration than something that's a little bit more superficial. If it's a little bit wider and I'm trying to get the scar to narrow, I'm trying to basically go in the inside walls of the scar and get it to contract a bit, I'm using a different concentration of TCA. Sometimes I use a different concentration of TCA on a single scar. So I'll use one concentration at the base, another concentration at the inside walls of the scar. So I don't know how anybody's going to be looking at this and thinking that they're going to do this themselves. It's just like, it's ridiculous. There's like doctors and, PAs and nurses who I wouldn't even show this to properly like that, because I see their hands, I see the way they shake. I just wouldn't do it. I wouldn't trust them to do this. There are a lot of times I wouldn't trust it. I myself, if I feel like I myself wouldn't want to be like on the table when I had more scars and like when I was going through this process, why would I have it so that other people would go through this and do the same thing? There's no way. So like it's to me it's something that like I think people should really respect like the way that people do things. And it's like people should stay in their lane. Like there's certain things that you could do very, very well and do that, and like, make money off of that, do whatever else we want to do, just get a lot of enjoyment in it and like help people out with that. And like, that's what you do. And then let other people do like what they need to do and like do that at a very, very high level. And that's like the way the world could work, It's just like, it's exactly perfect that way, because like everybody just like has their own world that they do, and they just do it very, very well, and they enjoy doing it and enjoy growing from it with it. And it's really fun to just keep on getting better and better and better at something. And that, like, to me, is like awesome. That's what I do it for. It's like fun every single time. Look at this this patient's scars. It's like looking at this, and I'm thinking to myself, when I was looking at it, this is a puzzle, and like I'm going to solve this, and this is how I'm going to solve it. Do this step by step. And after a single session, we got to this, and it's awesome. And Fitzpatrick 5 patient. That's very, very difficult to do correctly, and there's really, really not much room for error. So you just got to do it really properly. So Filter Daddy's saying, so no one should do it except for you. No, I'm not saying no one can do it. It's a TCA Cross. There's other people in the world that could do TCA Cross. I'm not saying that at all. I'm saying that people shouldn't do it themselves. And like I myself do the most in the world, and I would just never do that on my face. Like I would never do TCA Cross on my own face. And so it's like, I would see like, I was like that. It's just like, there's a really high risk with it. But what I also would say is that like, if people want to do it, of course, do it, go for it. Go do it, and then like talk to me and see if like how it goes, and go feel free to do it. I'm not like going to stop you. It's like I don't need like TCA Cross as a business for myself. I'm like, everything's going well in life. It's like TCA Cross, I need to do it for patients to get the best possible result, but it's not like I need to do it for like a business standpoint. So it's like, okay, like if people want to do TCA Cross at home, feel free to do TCA Cross, and like, let me know how it goes, and if I'll be here to help you if you end up getting it wider and deeper. There's a few things that we'll be able to do to help you out with that. I just personally, myself, who does the most TCA Cross in the world, would never do TCA Cross on my own face. So I put 2 and 2 together with that, and I think you could be able to determine that this is probably pretty risky to do. And I myself have managed many complications with patients who have done TCA Cross professionally with dermatologists who do a lot of scars or so, and they've caused a lot of complications in a lot of patients, and I've fixed it. So I'm not saying that no one can do it. There's actually a lot of people that can do it, but I would say that there's very, very few people in the world that can do it very, very well. And I doubt that there's going to be people that could do that at home on their own face. Let me just say that. Are you saying have someone else do it on your own face? Have a professional do it, not just anybody else. Have a professional. Have someone who's got very, very steady hands do it, like extremely steady hands. Just watch how they're doing it. Watch what they're doing. And you can see, like, just see how steady they want. And just look and just keep, when they're holding a paintbrush, make sure they're not like, like they're not dabbing it around. They're not like spraying it everywhere. And you'll see some people, like actually the other day, it showed up on my TikTok feed that someone was showcasing the way they were doing TCA Cross, and it's splashing all over the face. It's going all over the face. And it's like, they're using a syringe and they're squeezing it down. They're squeezing too much on there. And so it's like, look at that. And you'll see that. You'll see exactly the difference there. You'll see that there's a reason why people do run into problems with TCA Cross. So I believe in it. I use it every single day, multiple times a day. But it's like, it's got to be done a certain way. It has to be done. Otherwise, it's just not going to be effective enough, or it could potentially cause complications. PK Farnsworth is saying, results look great here, Dr. Qazi. Congratulations to you and the patient. How many weeks after Bellafill placement are you and your clinic comfortable with Pico laser or the light resurfacing laser? We could do that right away. There's no problem actually with that. I could do that right away. Can you explain the Fitzpatrick scale? I'm almost done for the night right now, but I will say a few things. That there's really a lot of evidence that showcases that it's not as relevant today for all the different ethnicities. So kind of briefly, for those who don't know, Fitzpatrick scale is basically a scale 1 through 6, and essentially we can determine patient skin types. It's not based on the color of their skin. People get very confused about it. Actually, people for some strange reason get almost offended by it. They say that, like I put them as like a darker Fitzpatrick, but it's not about necessarily the color of your skin. It's about how you react to the sun. It's about how the melanocytes react, I should say. So for patients who burn and only burn, you're a lighter Fitzpatrick. Patients who tan first, or I should say who burn and then tan, they're going to be in more of the middle Fitzpatrick. And then patients who just only tan and they don't burn at all, they're going to be darker Fitzpatrick. So what does that mean for your purposes? It means that lasers could be riskier if you are somebody who only tans. If you don't get burned when you go outside, a laser actually is riskier. And that goes for all energy devices. And in fact, it also goes for radio frequency microneedling devices, anything with heat, anything with energy. It could potentially be risky now for you. And even actually microneedling by itself without even the heat, because what it's doing is it's causing this redness on your skin, and it potentially could cause you to get hyperpigmentation. Now, the thing that gets tricky for people, a lot of practitioners, a lot of people get very, very confused about it. Asian skin type is particularly East Asians who are Korean, particularly Chinese as well, Japanese. It confuses people a lot. Sometimes people will just look at the phenotype, look at the skin type, and think to themselves that, oh, this particular patient, let's say, for example, Korean patients, light skin type, and hey, they have deep scars. I could go pretty aggressive with this patient. And also, awesome, by the Fitzpatrick scale, this Korean patient in front of me, they're burning. They get burned when they go out in the sun. They get burned. And so clearly they're going to be a lighter Fitzpatrick. We're going to be able to go pretty aggressive on the laser, and we're going to be okay. The problem is that they actually still have a lot more melanocytes than Northern Europeans. And you could end up triggering those melanocytes and causing more hyperpigmentation. And in fact, you see that over and over and over again. Most of my practice is Fitzpatrick 4 and above. Vast majority of patients, 90-something% of our patients at this point are Fitzpatrick 4 and above. I, of course, can treat lighter Fitzpatricks. That's not even a question. It's just that the darker Fitzpatricks are much more complex to treat safely over and over and over again. Very, very difficult, because you don't want to use high heat, high energy, really, unless you really have to do it. And if you are going to do it, you're doing it in certain spots. Like, for example, this particular patient, certain areas is where I did it. I did a lighter laser everywhere else, but certain areas is where I did the CO2 laser. So you could do it a certain way like that, but you can't do bulk heat, bulk energy. And what you hear from a lot of practitioners is that they'll believe that in order to solve these scars, you have to go very aggressive with the CO2 laser. You'll hear it over and over again. over and over again at these conferences. I don't even go to these conferences anymore, but like, you know, because it's just like sometimes you'll listen to this stuff and it's like, I don't know what you're talking about. They'll go up there and talk about how you have to go, like, this laser is the best laser, this energy device is the best energy device, and you can go max settings and it's got like 40 power, blah, blah, blah. And it's like, dude, like, why are you ever going up to that high? Why are you using that much heat and energy? Even in light Fitzpatrick 1 and 2 patients, I would never go that high. And now at darker skin type, you're talking to people and you're saying that you go and do these lasers at very aggressive. You have to go very aggressive with lasers, and it's always like that. The way they say it too is like they're, there's too much testosterone. They're trying to like they're all these guys that believe in like excess TRT replacement, and it's like, you know, they're doing all this stuff, and then they're boasting about the fact that you have to do lasers and energy devices really, really high heat. Hi, Sheikh. How's it going? Good seeing you on. GT is asking, does subcision cause sagging? It could, depending on the location of the skin or the location of the face. Really, if you're doing the lower part of the face, you're using certain blades, like a tailor liberator, for example, or a tulip cannula, that could potentially cause sagging because you're displacing some of the fat pads, and so you potentially could. Which is why you have to be very precise, very careful. We had actually, right now we have a student with us, and he was shocked by the fact that I don't do as much tailor liberator as I sometimes, like sometimes you see these severe cases, and I'm still able to succeed, which is blunt cannula subcision. If I need to do tailor liberator, he was like, you know, you're only doing it for 1 or 2 areas. That's exactly the way I want to do it. That's exactly how I do it. I just do it for certain spots with a sharper tool like a tailor liberator, but I don't do like this full field way. I don't believe in it. I don't believe in doing it that way. Just like do it with the blunt cannula, feel every single scar tissue that you could feel those tether bonds, and it takes more time. It's definitely a more tedious process, but fortunately I'm okay with actually just things just taking a long time and just going on and just doing it over and over and over again. Actually, today's case, that patient that you guys were asking about that came in from Alberta, Canada, his case was very complex, extremely complex. It was very, very deep, ice pick scars, boxcar scars. It took me a long time. I just kept on shaving down his skin with the CO2 laser. It took a long time to do that effectively and safely. It was just like layer after layer after layer after layer after layer after layer after layer. And fortunately, I actually enjoy doing that. So I'm somebody who, like, ever since I was a little kid, always enjoyed doing those type of things. So it's like, you know, that's pretty good. Like when I'm like building something or working on something, I'm actually like just going at it and going at it and going at it and going at it. So it's like, I'm like the one person that's like, okay, I'm just going to keep on doing this. And like, then you'll see other people just rush it and just like, and like, they just get so like hyper about with it. You literally will see them do that. They get so hyper and like, they get so like flustered in like the OR, or so flustered when they're doing a procedure because it's taking too long, and they're just constantly just like clock watching and stuff like that. And it's just like, settle down, dude. You know, everybody wants you to, like, it's okay if you're a few minutes late for the next patient. Everybody wants you to give the best possible results for if they're on the table there. So, and you know, these patients come from so far away. You got to make sure it's the best possible result over and over. And they suffer for so long. You have to. This is a single session for this patient. He came all the way from the East Coast, saved up so much money to come do this. And like, I had to make sure this was done properly. You just have to do it. You just have to do it. Like, you shouldn't do it if you're not doing it properly. So it's like, at least I'm going to just keep on doing it that way. I'm just going to keep on going layer and layer and layer as long as it takes. We have to do it that way. Bushra is saying, agree, don't do it on your own. She's talking about the TCA Cross. It's risky and not worth it. Seek knowledgeable and experienced professionals. My patients have great results in office. That's awesome. Yes, that is exactly perfect. You're right. You're exactly right. That the key is to go to a professional, because the truth of the matter is that like, I would never do this myself, who does the most TCA Cross, do this stuff on my own face. I don't do my own fillers, things like that. It's like, I just wouldn't do it. Just like, it's so risky. Lucky Singh is saying, there are many stories of people who have had severe burns and war scars from at-home TCA Cross treatments. Thank you for putting the cautionary warning out there. Your concern comes across clearly. Thank you so much, Lucky Singh. Can you feel the Bellafill underneath the skin? Does it feel lumpy? Can it move from where you inject it? So that's what Cece's asking. I appreciate the question. Actually, Cece, if you ever come to the office, you can feel my skin, and you can see that there's nothing worth like that. It just feels like normal, healthy tissue. That's what it feels like. What is most effective laser for mild white stretch marks on the body? Actually, the erbium laser works really well, and then through the laser tunnel holes, you could put a dilute form of Latisse, for example, and that could potentially trigger more of the melanocytes there. Let's see. Our user 44 is saying, do you think laser technology has advanced a lot in the last 5 years to a point that I should wait? I'm not sure I understand the question, but I'll tell you, this is not about lasers. It's not about the energy device. It's about the technique. It's how you do it. It's not about the device at all. User 44 is saying, I love your discussion about different races and how it affects the skin. Hope to hear more about it. I appreciate that. Thank you so much. I pride myself in doing that. Let's see here. Eric Callahan is saying, I asked this last week, but my computer shut down before I could hear your answer. That damn computer. Why does oil production need to be controlled with isotretinoin before doing TCA Cross on nose pores? And can TCA Cross be done without isotretinoin if we want to avoid possible side effects? Great question, Eric. So the thing with oil is that sometimes it actually can make pores and your scars look wider. And then the other big issue is that it could actually delay your collagen response. So that's a really big concern. It's inflammatory and can delay your collagen response. Now, I'm not sure if I necessarily saw you or not. Your name, I'm not entirely sure if I did. But the thing is that it may not necessarily be from acne. It could also be from rosacea. So I don't know why you have oil production. Is it due to acne or is it due to rosacea? If it's due to rosacea, that's also something that you want to control and manage. So if it's a rosacea issue, really consider something like metronidazole, ivermectin to manage the rosacea, calm it down so that your oil gets less and then you have less inflammation and you can get a nice, robust collagen response afterwards. So hopefully that helps you out. But really, I do control the oil before I treat a lot of these scars because I want it to actually just shrink just on its own. Just controlling oil shrinks the scars and then you get a more robust collagen response afterwards. So that's really the main thing. What is this single combination of? This is with Subcision, this is with TCA Cross, this is with laser, and this is with some Bellafill over here. Hello, Cold Frost. Good seeing you on. Thank you so much. Can Subcision and filler and TCA be done on forehead scars? Yeah, that's actually a great combination right there. You just hit the really perfect combination there. I got prescribed Dapsone and clindamycin. It sounds like you're one of my patients, Cold. Can I resume tretinoin, and if so, what percentage? You probably could. Yeah, you probably could. About a little low dose tretinoin, so 0.025 is typically what I end up doing. Just talk to our office if you are my patient. Sounds like you are because that's usually my combination for acne. And that's like, I'm just telling everybody, now people don't realize that you need to be on some sort of topical antimicrobial, something that's going to help you out with the bacteria that's on your skin. Dapsone works very, very well. You may need clindamycin if there's active lesions, and then something for oil production. So tretinoin helps with the oil production. So all of those actually could be great options there. All right, guys, I appreciate you. I know there's a few questions that we're still on, and I know since I wasn't on here yesterday that there's a few more, but I will circle back with you. Also, I saw some submissions on our page at drqazi.com and the community section there for people, they wanted me to comment during the lives on their treatments plan, and I'll do that for you. I'll do that tomorrow, actually, for you. So if you want to submit more, I will go through a few. So why don't you submit more? Go to drqazi.com and you can submit some more, like just things that you want me to take a look and see how your scars are or what we should do for your scars. And if you want some advice on them, I'd be happy to help out with that. All right, guys.